question one, what made you want to become a PA?
I'd always had a fascination with medicine and anatomy, physiology type stuff since I was in high school. I actually was a pre-med major when I started college, but the study program of freshman chemistry sort of threw me off that path initially, and switched to a psychology major, and that's what I got my undergraduate bachelor's degree in. And when I started, after I was done with that, I was working in computers, didn't really know what to do with my psychology degree, and enjoyed computers, and ultimately hit a point in my career where I needed a change, whether that was to study more in an area of computer technology or do something different. And as I was exploring the alternatives, the medicine in me started to resurface and explore those options. And I learned about the physician assistant profession, and it seemed to be a good fit for what I wanted to do, especially with my psychology background. As I compared to medical school prerequisites versus PA school prerequisites, the medical school, the contrast that struck me was medical school generally required some hard sciences, I would call them, like physics and genetics, versus additional requirements for psychology courses for PA school. And in my mind, that set up sort of a picture of the practice of medicine, and in my mind that I would much rather treat the patient from that more holistic, incorporate that psychology aspect of what I had learned versus treating as a science project in genetics and physics and the like. And so that's how I ended up going into the PA profession.
It's great. And also like such a cool journey, especially like sometimes it can be intimidating, I imagine, to make that kind of a career change, but it seems like it's been a great fit. So glad.
Yeah.
So what drew you to practice in primary care?
A big part of it was I'm fluent in Spanish. I'd been a missionary for my church and had learned Spanish in another country. And so I really felt driven to use that in my practice of medicine. And I felt like the best way to do that was in a general practice environment, and particularly in a underserved type clinic that addressed the needs of underserved populations.
Yeah, and that's such a great asset to have, especially with the growing Hispanic and Latino population in America. Having that Spanish is critical, so that's cool. So how did you first learn about the National Health Service Corps, and why did you ultimately decide to apply?
It was actually as I was investigating PA schools. The one closest to where I lived at the time was a private school, so it was quite expensive. And so I met with the financial aid director of that college, and she introduced me to that idea, that she was aware of the National Health Service Corps loan repayment and scholarship programs, and sort of directed me to learn more about it.
Awesome. So what was the application process for the NHSC like?
Well, I understand there's been some recent changes. I applied back in 2010, and I guess unsurprising, as a federal government program, there was a whole lot of complicated paperwork to fill out, as there is for most government programs, it seems. It was a bit laborious, to be honest, to gather all of the financial and loan information that they required, and the way that they required it at the time. I just remember it being quite a chore to get all the information together and in the way that they wanted it.
You said you've heard it, they've made some changes to reduce the administrative barriers.
That's what I've heard. Last week, I was talking to a faculty coworker and who has been working recently with HRSA, and he told me that there's been some streamlining that's happened in the application process to make that a little bit easier, and certainly that would be much appreciated, and probably allow greater access to people who may not have the assistance or support to be able to fill out those types of forms or get that information.
Yeah, that's great to hear that they're streamlining that. So other than heads up on the paperwork, what advice do you give to students interested in applying for the NHSC?
It's a good opportunity, and all medical education is expensive. And I think most people who are looking toward medical careers are not so much in it for the money anymore, as the economy has sort of balanced out our salaries that we get with some other industries, but they're more so in it to help people and have that drive to help people in need. And so I think that HRSA and the NHSC in particular will help subsidize that effort so that it can help buffer the costs of medical education, whether it's PA school or nursing school or medical school. That's an avenue to help make that desire to serve be fulfilled.
Yeah, absolutely. So for those who are unfamiliar, can you describe the process of finding an employment site to fulfill your service commitment?
I sort of stumbled upon mine. There is a job listing on the NHSC website. The postings, a lot of them seem to be almost standing job postings, especially in the high needs areas. And so I found that some of the hiring deadlines, at least back when I was looking, and granted this has been several years, that some of them, the hiring timelines might be different. They aren't always a job we want somebody now, but maybe something they're looking to fill in 6 or 8 months. But the jobs that I had actually was through a recruiter who had brought me to the Tulsa, Oklahoma area for a different job. And she had been hired to find somebody for this position in the FQHC, where I ended up qualifying for the NHSC loan repayment. And so that worked out. It wasn't a job that was listed on the NHSC website, but they happened to be targeting that underserved community of Hispanic patients in particular, and qualified for that NHSC loan repayment.
Yeah, and I think it's good to highlight that, there's multiple different avenues that you can access some of these opportunities, like the HRSA Workforce Connector, or simply just networking and stumbling upon an opportunity like you did. I think that's a highlight. So how did you interact with HRSA while you were in school and once you began your service commitment?
In school, I did actually apply for the NHSC scholarship program and interviewed for it. I wasn't selected for the scholarship, so during school, I didn't have a lot of interaction with NHSC. One of the faculty members where I went to school was an NHSC ambassador, so she also shared at one point in the program about NHSC and the opportunities that provided. But aside from that, during school, I had little interaction with them. And it wasn't until it was actually my second job. The first job I went to had promised something akin to the NHSC loan repayment at a state university, and it didn't work out. It turns out it's hard to compete with the NHSC loan repayment program, and so ultimately that second job that the recruiter helped me to find got me in the right spot.
Yeah. So what would you say to a student or graduate who's hesitant about the service commitment due to salary concerns or fears about working with challenging patient populations?
Again, that maybe goes back a little bit to the service component that I think a lot of medical professionals have. Usually people looking for that type of experience are okay with those challenges as far as the patient population. There honestly is a salary difference, or at least in my experience, there was a salary difference for that type of clinic. But certainly the salary difference was offset by the amount of money that comes tax-free from the National Health Service Core Loan Repayment Program. And I think that's something that a lot of people aren't aware of, how much of a difference that makes for all of that money to be going toward your student loans versus the money coming in as income being taxed at 25 to 30%, and then you pay your loans. So I think that makes a big, it does offset the salary difference to get the NHSC loan repayment.
I was also curious because you'd mentioned that you worked in Tulsa.
Mm-hmm.
So I'm wondering, like, was the cost of living also like more affordable in those areas? And so was like the salary sort of commensurate to that in your experience?
In that case, yeah, Tulsa generally had, even though it's a major metropolitan area, uh, Oklahoma in general was a lower cost of living than many states, and so that's definitely true. That helped in that case. That may not be true in all states, honestly. If a state like Minnesota, where I'm at now, has a higher cost of living, and out in the rural areas of Minnesota, that may still be the case as far as cost of living difference in rural Minnesota versus rural Oklahoma.
Yeah, that makes sense. So what has been your proudest moment as an NHSC clinician?
I would say that it was mostly the service to the patient population. The patient population of those types of clinics, at least in my experience, were very thankful for the service that they were able to access, that likely otherwise they would have very limited access to healthcare services, especially a preventative general practice type of situation. Many of since I work primarily with the Hispanic population, many of them will often delay health care until they just can't work, and they are too sick to go into work, and then they end up going to the emergency department and getting extremely expensive medical care there. Where having a community health clinic like this that could accommodate people without insurance at low costs, and for both the medical visit and the lab costs, it really changed a lot of people's lives, I think, to have that preventative care, the maintenance care that kept them healthy and working and out of the emergency department.
Yeah, we all know how those bills can get. So
Mm-hmm.
great that you were able to do that. So what skills have you gained from your service commitment, and how would you say these skills will benefit you throughout your career as a PA?
The best answer I could come up with that was for a special awareness of costs of healthcare. Um, it, it seems, especially in our country, it's not unique to our country, but um, medical costs are a bit out of hand in most cases, and we tend to test just to reassure ourselves when it may not be necessary. And so that's something, especially as I've transitioned to education, medical education, is to be able to share that perspective with students and future providers, that the awareness of the cost of care and what we can do to help mitigate the cost of care for people who may struggle to pay for those resources, and the ability to have that impact on the community as well. I think being able to help get access to health services within a community of high needs is also an important skill, and politically to be involved, to engage in your local state PA academies to lobby for health services and those who may be underserved. All of that I became much more familiar with in community health service, like I did with the National Health Service Corps.
Yeah, and I'm really glad you mentioned that cost factor too, because I think sometimes you wouldn't even think to ask, like, oh, can my patient like afford this medication? Like, what
Mm-hmm.
out there. And so like that's something I've heard a lot of feedback about from different PAs that I've talked to that was eye-opening for me as well. Cause I don't think I've ever had anyone ask like
Yeah.
or not it would be something I can afford or what my financial limitations were. So that's a great point to highlight. So I didn't confirm with you, but are you still practicing in an underserved community now?
Not currently, no. Since I moved up to Minnesota, I've been in an education role, and so we're teaching people and encouraging them to reach out to underserved areas within the health system of our institution. There are a lot of rural health clinics throughout southeast and southwest Minnesota and western northwestern Wisconsin, and so a lot of our students go out to those rural communities in their clinical rotations during training, and that's where most of the jobs are in our institution. So that's a big part of our education curriculum here, is encouraging that and being aware of the needs of those areas.
Did you end up staying past your service commitment where you were working?
I did. It was about 3 years or so beyond. It was actually a little bit of a snafu, I guess you could say. We had a CEO change in the clinic, and he was not a medical professional, didn't have a medical background, and sort of misunderstood how the clinic could maintain its HIPSA score rating, and hadn't done the administrative paperwork to verify the underserved population that we served. So the HIPSA score of the clinic actually dropped several steps, and I didn't qualify anymore for the loan repayment. And it was a quick turnaround once they found that out. I think within 2 weeks, they updated the whatever paperwork application, and they were back up to the level that they were before. But at that point, I was looking to transition to another clinic.
Gotcha. Okay, well, that was all the questions that we had. I'm going to go ahead and pause the recording.